Yeah, so traditionally, one of the most kind of widely researched and used anthropometric measure was the body mass index. But there are certain fallacies with that. A person can be muscular as well and have a high body mass index. What a waist circumference does is that it cuts off all the muscular aspect of a person's weight, and especially in men more than women, a waist circumference actually gives a very good indicator of the amount of visceral fat. And when we say visceral fat, it is the abdominal visceral fat, and that is which is dangerous for a person in terms of development of cardiovascular disease. It gives an idea of whether the person is insulin resistant, and that particular fat is also very pro-inflammatory and pro-thrombotic. And Indians per se have this tendency of depositing fat in the visceral area, in the waist circumference. So that in the depositing fat not all over the body, but in the visceral area, in the abdominal fat or the visceral fat that we call. So that kind of gives an indication of what is actually happening within the body in terms of whether the person is actually insulin resistant and how he's able to process the amount of sugar that he's consuming. So, yeah. It's just about, just to be very candid, I think so. It's just about the convenience of it. And because the doctors, and very understandably, are so overburdened with work and the number of patients that they see, these kind of anthropometric measurements at the level, and because primary prevention is not such a big deal in the whole medical landscape in India. So that is why all these biomarkers, which are kind of traditionally and research wise and in literature, are so important, but they don't get their due in clinical practice given that much importance because of the time constraints that the doctors have to kind of go through. So that is one of the reasons why it's not done, just for the practicality of it.
Okay, good.
Yeah. So of course, the reason why this is so important in terms of actually driving behavioral change is because we want to give that option to the population, general population, to pay more attention to. A person can still do the right things and still have deranged biomarkers, but at least we are giving them an indication as to where they lie. So the current set of biomarkers, the current traditional risk factors that were there, are kind of being challenged in a way with the new research that is coming up, and we want to kind of give that emphasis to the patients as well as to the doctors, give them more kind of an armory in terms of how they want to treat the patient. It's not about trying to change the way they practice. It's just about giving them more information so that they can make more informed decisions. And we want to drive that change in terms of also increasing the, how do you put it? What that would be again telling the doctors what to do. In terms of suppose if I put it that way, that it is kind of we are way past that point where the traditional risk factors play any significant role, or they have. The importance of those traditional risk factors are still there.
Yes.
But new evidence is emerging in terms of how the whole process of development of cardiovascular disease away from the traditional risk factors and those biomarkers which kind of how do I put it?